There are two different directions we might go with what we call vocational or career types of assessment, especially when we're talking about psychological components to it. The first one really is more around inventories, like interest inventories. Some people call them aptitude. You'll see a lot of times these are done at college and career centers in high schools. And the goal just being that we have students that have certain, and I won't call them intrinsic, but they're interests. They might be hobbies. They might be the types of books they read, the kind of things that they do in their off time. Certainly the way that they're hoping to possibly progress professionally or even personally. And so there are some instruments that are done that their only goal is really to provide an opportunity for the student to have a little more insight into the direction that they might go, potential job opportunities, potential work opportunities. Some programs, I worked with one in Hawaii, that the high schools had this really innovative program where after the fourth quarter of sophomore year, we would do this comprehensive, what I call an inventory, an interest inventory, and within that we would then provide opportunities for students, and this was part of the dropout prevention program, although we used all continuum of students. But the goal was that they had programming, school programming, where individuals could going into their junior year, instead of going into traditional language arts and math and science and history classes, they could go into auto mechanics, carpentry, electrician, cosmetology, child care, computer science. They could do all these different, even robotics, which was kind of neat. But they could go into getting 12 months education specific to that profession, and then the second half of their senior year they'd actually do what's called an externship, where they would go out into the community or even in the facility they're in, and they would provide that service under supervision so that they would be accruing hours towards apprenticeships and those types of things. And then at the completion of that, they don't get what's called a traditional high school diploma, but they get a certificate of completion. And in many ways, because it's a vocational type of training, they also have a connection in the community through the high school for employment. Many times they're even employed by the people that they do their externships with. So that's one way that psychologists or psychological assessment can be utilized. And it doesn't involve the MMPI. It doesn't generally involve cognitive assessment or IQ assessment, although there can be some abbreviated tests that are done. There's one called the Shipley Institute that's literally just two sides of a page that gives a little bit of understanding of some of the analytical skills someone might have, but you don't come up with a formal IQ score. But in most situations, the vocational information that's drawn from that type of evaluation, it's really more around aptitude and interests. The other direction that we might look at is more around candidacy. And a couple of good examples I do evaluations for individuals that are applying for candidacy for officer training. They want to be admitted into officer training, and so part of that process is a comprehensive psychological evaluation in addition to what we would call aptitude, different types of aptitude than interests. These are more aptitudes about, are they more verbal, are they more perceptual, what is their processing, can they simultaneously integrate information and then synthesize it in a meaningful way to problem solve or cope, how well do they adapt. So it's not necessarily what are they interested in, it's more what skills do they use to problem solve, and it's a variety of problems. That can lend itself to candidacy. The other part of it is MMPIs. They're part of officer, they're part of the FBI, they're part of the CIA. I've not done the CIA stuff, but it really is very similar in terms of evaluative. And so for the FBI, it's the behavioral science program. There are already candidates in the FBI. but now they're applying for a very specific area of the FBI's functioning, and there's a profile. And because there's thousands of applicants, the program really needs to know that the individuals that they're going to wean down, so from 100, they really want to get down to about 7, maybe 10. And those individuals have what we call a traditional profile of someone that fits that job. Now, it doesn't always mean that there's only one profile for the job. It just means that because there's so many applicants, the agencies, the organizations want to know that the individuals that they're working with have met some of the more stringent criteria, as well as they demonstrate psychologically the attributes that are synonymous with being successful in that realm. I can give you a good example from my own personal experience. I do quite a bit of it's programming that's part of getting certified postdoctorate in forensic psychology. And so I have individuals that are applying, that are in the program with the goal being that they want to get certification, board certified in forensics. So they're already doctors and they want to get board certified in the area of specifically in forensics. And so the program is 64 credits, and it's the whole continuum from jury selection to competence hearings to insanity hearings to evaluation for remediation, evaluation for fitting certain types of treatment, evaluations for parole, jury selection is a wonderful area that forensics is going. But anyways, there's a profile of the individual that not meets the demands and gets their degree in forensics, but their longevity in forensics. And the reason I say that is because when you look at the field, the science, the field of forensic psychology, the average forensic provider stays in that field actively 7 years. It's a difficult field. And so I'll give you an example. You have an individual, he has been working for the LDS church, the Mormon church, for a little over 9 years. And in those 9 years, he has been a child care worker. So when they're in services, his responsibility is the supervision of the children. Primarily, his area of focus was pre-6-year-olds. And so over about a 3.5-year period, he has over 1,000 incidences with over 300 different children. Digital penetration, frottage, lots of grooming. I mean, just tragic. So anyways, this individual eventually gets caught, and part of the process is his defense attorney wants to have him evaluated because they believe there's something wrong with the guy. Now, granted, what I just presented to you supports there's something wrong with the guy. But this defense is looking at, is there something that would reduce his culpability or accountability because of something psychological, neurological, that impairs his ability to not commit that crime. So I do this formal evaluation. In the formal evaluation, there's no question there are lots of red flags. In fact, if you remember when I had clinical interview up here, I said one of the areas I look at is congruence in symptomology. Lots of incongruence. There was something about the way the guy presented that told me he completely understands what he's doing is wrong. He finds it to be catastrophic that he does this. He can't seem to identify what precipitates it or leads up to it, but he definitely understands that there is this moment when he loses what he calls rational ability. And so it doesn't fit. There are some parts of him that fit pedophile, but there are other parts that don't. And so I recommend that we do a forensic neurological evaluation with the specific referral question of, I only want to look at his temporal, which is essentially looking at his affective regulation, and his frontal, looking at his capacity for executive functioning, his capacity for moral reasoning, his capacity to understand the relationship between cause and effect. And so we do this, and we find that he has several lesions in his frontal lobe, and one major lesion in what's called the reticular formation, which is in the back of your head. The reticular formation has one goal. Its goal is to say, where do I send the information to best problem solve? And so if I put my hand down on a fire, on a hot spot, the reticular formation sends a message to my motor strip that says, move the hand before I even recognize I'm in pain, because there's pre-conscious functioning. This particular individual, the way his brain's wired, when he has arousal, hunger, thirst, sexual, aggressive, when he has arousal, his reticular formation sends no messages to his frontal lobe, which is the part that says, wrong, don't do it. It only sends it to his arousal center, and so he gets an erection. He is so aroused that he can't rationally think of anything other than, I need to get out of an aroused state. It's actually causing anxiety. And so in his anxiety, he then molests, and in the molesting, either he is able to ejaculate, or following the molesting, he goes and masturbates and ejaculates, and he returns back to what we would call conscientious functioning. He's remorseful, and he completely understands what he did is wrong. All those things are in place, but prior to ejaculating, he is at such a heightened state of arousal, his frontal lobe has no firing. There's no rational consciousness, moral reasoning, ethical reasoning. None of those things are going on. Just, I need to get this fixed, this anxiety of this erection, this turn on. And the only way to do that is to ejaculate. So my presentation to the courts is, this guy cannot be held accountable for his crimes. He needs brain surgery, or what we call chemical intervention. In Switzerland, you're able to do what's called castration, limbic castration, chemical castration. They don't have the same ethical guidelines. And so this particular individual was able to volunteer to have essentially the part of his brain that leads to planning and grooming for that offense, that molestation, interfered with. And so we essentially demyelinated the message so that it got fragmented. Instead of resulting in him having to act out on it, we were able to minimize the arousal. And because of that, he was held, he had a 2-year probation period, and he had to go through a lot of therapeutic intervention in terms of reframing, because he had great dilemma in terms of guilt and remorse for what he had done. And so, should that person be held accountable legally? Should he be incarcerated? Not if he's disabled. And so the forensic professional, they have to be willing to do that. They have to be willing to go on the stand and say, you can't put this person in prison, it's not his fault. And you find in this field, there's a lot of people that don't have the stomach for that. It's brutal to watch someone commit murder and get away with it, and I don't mean get away with it, but have a different disposition in prison because of something that my evaluation demonstrated. Or someone that is a model prisoner. For 5 years, they've done nothing but all their treatments. They've stayed out of everything. They've not done any drugs. They've been volunteering for community service. They've done everything. I do a psychological evaluation. That evaluation demonstrates that they still have the propensity for the types of crimes that got them into prison. But while in prison, they're not demonstrating it. And my recommendation is that they're denied early release or parole. You have to be able to do that. And so there's an aptitude that comes in the psychological profile of an individual that works in this field, because it's not for everybody. There's a lot of cases where you say, I have to do the right thing. And the right thing is not always the right thing. So these evaluations for officer training for FBI cadets, especially in the behavioral science unit, they're another place where psychological evaluation is a component to a diversion program in high school so that they learn vocational school or vocational certification skills to then have a job without there necessarily being a goal of college attendance, or it could be used in the capacity to identify probability profiles of somebody that has what we would consider to be the traditional profile of somebody that fits what they're applying for. I don't do any work with Navy SEALs, but they go through something very, very similar, and it's looking at a specific attribute, a psychological attribute called resiliency. Some people call it temperament, but really it's how much can they handle whatever they're put through. And it's not always internal or external focus, torture or discomfort or extreme. It's a psychological or ego strength that suggests that they're going to be able to handle the demands of that type of a job and some of the things that they have to do. There are times, and like I said, I've not done anything in terms of the evaluation of that, but I have done some where there's been individuals that have been involved in what are called military crimes. I've done a couple of evaluations for the JAGs in the Army in particular, for individuals that have committed what we call a crime in the military capacity, and then we have to do an evaluation to determine their degree of culpability. Interestingly, and I'll add this side note real quick. Interestingly, oh gosh, that seems like a long time ago. In 2007, we did an evaluation that included 179 ready to be deployed military individuals, all of one branch of the military, and they were all about to be deployed to active wartime duty in another country. And so the evaluation had one specific goal, and that was to look at aptitude. Now, the study was through Tripler Medical Center and our Tripler Veterans Association or hospital out in Hawaii. But the goal was to say, can we start to see predisposition to psychological phenomena as a result of extreme military exposure? Very wordy. Essentially what we were looking for was capacity to have an incident or an experience during their deployment that could result in PTSD. Now, out of 179, we identified 42 individuals that had what we would call profiles of individuals that aren't very resilient. And because they're not very resilient, they're not going to be very adaptive. And because they're not very adaptive, they're going to have psychological trauma from experiencing some of the things that they're going to possibly experience due to their deployment. Out of 179, 161 came back. At 161 that came back, out of the 40 that were identified, 47 that were identified with the potential for low resiliency, 45 of them had what we call clinical diagnosis of PTSD. Of the other individuals that were not identified as having those attributes, that profile, 2. There were only 2 individuals that were not identified as having the higher potential or probability for PTSD that actually had those symptoms. And interestingly, within 18 months post-deployment, the 2 no longer were showing those symptoms. They responded to intervention. And the other individuals, only 2 of them did respond to intervention. So again, it's interesting to look at. So we certainly don't want to draw formal conclusions about, how probable someone is psychologically in adaptation, but it is interesting when you start looking at, we have thousands of people applying for minimal positions at some of these higher levels, CEO levels, officer levels, cadet levels, analytical types of positions, and so they utilize psychological evaluation to also talk about aptitude for those types of jobs. Now, granted, within that, there's going to be people that are excluded from that, but because there's such a such a high number of applicants for a lot of these positions, the law of averages says that it's improbable that you're going to miss the perfect candidate by ruling out some of the characteristics or attributes that are not necessarily synonymous to that type of individual or the duties of that position. And so as we wean those down, there's a chance that we lose someone in there that might have been perfect, but there's still so many individuals that have a lot of the attributes we do value, or they do think are synonymous with success in that position, or longevity, like I talk about the forensic psychologist, that there's value to the evaluation. Anyways, that's the two places where we might see psychological testing involved. The interest inventories, types of things, if we're talking about dispositions or diversions in education, as well as rehabilitation. And the other component is when we start looking at appropriateness of candidacy or acceptance into types of programs.